A Senate committee advances healthcare nominees. The president signs an executive order regarding the price of prescription drugs. And House committees take the next step in advancing Republican budget reconciliation legislation. For the week of May 19th, 2025, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
And the chair will now recognize himself for an opening statement. Good afternoon, everybody, and welcome to today's markup, which is a rare opportunity to address issues spanning the full jurisdiction of this committee, from unleashing American energy to ending the costly EV mandates, advancing American innovation to truly strengthening the Medicaid program for the most vulnerable Americans, and improving Americans' access to quality health care. The House Budget Committee has
kicking this week's episode off with news from Capitol Hill, where the House Energy and Commerce Committee voted last week to advance its portion of the GOP budget reconciliation package in a 30-24 party line vote. During the marathon markup, which began on Tuesday and didn't conclude until Wednesday afternoon, Republicans voted down dozens of amendments from Democrats to block individual provisions of the measures containing the spending and savings directives from the fiscal year 2025 budget resolution adopted by Congress in early April. Democrats warned that the legislation will result in millions of vulnerable Americans losing their health insurance coverage, citing a May 7th estimate from the Congressional Budget Office that the number of uninsured people will increase by 8.6 million if the bill becomes law. While Republicans defended the measure as a means to address Medicaid fraud, waste, and abuse, and support the overall solvency of the program. Energy and Commerce's legislative text proposes work requirements for certain Medicaid beneficiaries, new limits on provider taxes, penalties for states who allow Medicaid coverage of undocumented immigrants, cost-sharing requirements for Medicaid enrollees, and more frequent enrollee eligibility checks. It would also repeal regulations from the Biden administration on Medicaid enrollment and nursing home staffing. The legislation does not address the 2.83% Medicare physician cut that went into effect on January 1st, but includes a mechanism to link the Medicare physician fee schedule conversion factor to an annual inflationary update. In 2026, physicians would receive an update of 75% of the Medicare Economic Index, or MEI. In 2027, and each subsequent year, physicians would receive 10% of MEI. It would also eliminate the current Merit-Based Incentive Payment System, or MIPS, and Alternative Payment Model differential payment updates. The House Ways and Means Committee also advanced its portion of the reconciliation package last week. The health provisions in the package include provisions to limit Medicare coverage to citizens and aliens meeting specific conditions, expand health savings accounts to additional individuals, as well as repeal the excise tax on indoor tanning services. The measure was advanced in a 26-19 party line vote. Speaker of the House Mike Johnson remains in negotiations with several fiscal hardliners who stalled House Budget Committee consideration of the reconciliation bill on Friday. 5 conservative Republicans on the panel, Chip Roy of Texas, Ralph Norman of South Carolina, Josh Breachin of Oklahoma, Andrew Clyde of Georgia, and Lloyd Smucker of Pennsylvania, raised concerns that the package does not make deep enough cuts to government spending or significant enough reforms to how Medicaid is funded. Reports indicate that the lawmakers have specifically taken issue with the fact that proposed Medicaid work requirements would not go into effect until 2029, and that states are not required to immediately remove undocumented immigrants from accessing Medicaid. The Budget Committee must piece together the individual portions of the reconciliation bill advanced by each congressional committee before sending the full package to the House floor for consideration. The Budget Committee is currently scheduled to reconvene at 10 p.m. on Sunday. The GOP aims to use the reconciliation package to advance President Donald Trump's domestic policy agenda, including tax cuts, energy policy, and border security, while trimming the budget deficit by at least $1.5 trillion. Republican leadership had targeted this week for a vote on the full package on the House floor. The bill remains subject to consideration by the Senate, which is likely to make changes to the House bill before passing the measure. A number of GOP senators have already raised concerns about the Medicaid-related aspects of the House package, with Senator Josh Hawley, a Republican from Missouri, characterizing the proposed Medicaid cuts as, quote, both morally wrong and politically suicidal, unquote.
Step by step, day by day, fresh start over, a different hand to play. Deeper we fall, the stronger we stay.
Congratulations on your nominations. Thank you both for meeting with bipartisan members and our staff throughout this process. These conversations have provided us the opportunity to highlight our priorities and learn more about how each of you would approach your roles at HHS.
The Senate Finance Committee voted to advance the nominations of James O'Neill to be Deputy Secretary of the U.S. Department of Health and Human Services by a vote of 14 to 13, and Gary Andres to be an Assistant Secretary of HHS by a vote of 19 to 8. Ranking Member Ron Wyden, a Democrat from Oregon, cited the nominees' endorsements of the current Republican effort to overhaul the Medicaid program via the budget reconciliation process as the reason for his opposition. The nominations now await a confirmation vote on the Senate floor. Eleven Democrats in the House of Representatives have sent a letter to the Trump administration raising concerns about proposed funding cuts to the nation's scientific agencies, including the National Institutes of Health, the National Science Foundation, the National Oceanic and Atmospheric Administration, and the National Aeronautics and Space Administration. The president's proposed fiscal year 2026 budget includes steep cuts to each of these agencies. The letter, which was led by Representative George Whitesides, a Democrat from California, highlights the importance of research for medical innovation and underscores the importance of maintaining investments in scientific research to maintain the nation's competitiveness with China. The letter reads, quote, "We urge your administration to follow the long-standing principle of bipartisan support for the scientific community and national leaders who have made science a national priority, embracing it as a driver of economic growth, public health, and environmental safety," unquote.
Basically, what we're doing is equalizing. There's a new word that I came up with, which I think is probably the best word. We're going to equalize, where we're all going to pay the same. We're going to pay what Europe's going to pay. We're going to all pay. Now, there may be some countries in dire need, and I would be willing to sacrifice that and help them. But it's called Most Favored Nation. We are going to pay the lowest price there is.
Last Monday,
world.
President Donald Trump signed an executive order that aims to ensure that Americans pay no more for prescription drugs than the lowest price paid by other developed nations. The so-called Most Favored Nations executive order instructs the U.S. Department of Health and Human Services Secretary to facilitate direct-to-consumer purchasing at these prices and to communicate target prices to pharmaceutical manufacturers within 30 days. If manufacturers do not comply, further regulatory actions may be taken. Additionally, the Secretary of Commerce and the U.S. Trade Representative are tasked with addressing foreign practices that contribute to higher drug costs for American patients. The president attempted to institute a Most Favored Nations policy in 2020 during his first administration, but the effort was struck down by a federal judge for failing to adhere to congressionally mandated rulemaking procedures.
It meant a lot. But so many of us have deceased sons, daughters, and relatives who died of cancer. I can think of no more worthy investment. I know of nothing that is more bipartisan. So let's end cancer as we know it. It's within our power. It's within
Final
our
news
power
today,
to
where on
do it.
Sunday, former President Biden's office announced that he's been diagnosed with prostate cancer, which metastasized to the bone. Although he was given a Gleason score of 9 on a scale of 1 to 10, demonstrating how aggressive the cancer is, his office said that, quote, "The cancer appears to be hormone sensitive, which allows for effective management," unquote. We end each week's episode with a call to order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Tuesday, May 20th at 10 a.m., the Senate Appropriations Subcommittee on Labor, Health and Human Services, Education, and Related Agencies holds a hearing titled, A Review of the President's Fiscal Year 2026 Budget Request for the Department of Health and Human Services. Second, on Tuesday, May 20th at 10 a.m., the House Oversight and Government Reform Subcommittee on Economic Growth, Energy Policy, and Regulatory Affairs hosts the hearing, Mandates, Meddling, and Mismanagement, the IRA's Threat to Energy and Medicine. Third, on Tuesday, May 20th at 10 a.m., the House Foreign Relations Committee convenes a hearing to review the fiscal year 2026 State Department budget request. Fourth, on Tuesday, May 20th at 2 p.m., the Senate Appropriations Subcommittee on State, Foreign Operations, and Related Programs gavels in the hearing, a review of the President's fiscal year 2026 budget request for the U.S. Department of State. Fifth, on Wednesday, May 21st at 10:15 a.m., the House Energy and Commerce Subcommittee on Commerce, Manufacturing, and Trade holds a hearing entitled AI Regulation and the Future of U.S. Leadership. Sixth, on Wednesday, May 21st at 10:15 a.m., the House Education and Workforce Subcommittee on Higher Education and Workforce Development holds the hearing, Restoring Excellence, the Case Against DEI. Seventh, on Wednesday, May 21st at 10:30 a.m., the House Veterans Affairs Subcommittee on Economic Opportunity hosts an oversight hearing titled Pushing VA Forward, Review of VA's Adaptive Programs for Disabled Veterans. 8th, on Wednesday, May 21st at 2 p.m., the House Appropriations Subcommittee on National Security, Department of State and Related Programs convenes a budget hearing regarding the Department of State and Related Programs. 9th, on Wednesday, May 21st at 2 p.m., the Senate Homeland Security and Governmental Affairs Permanent Subcommittee on Investigations gavels in the hearing, The Corruption of Science and Federal Health Agencies, How Health Officials Downplayed and Hid Myocarditis and Other Adverse Events Associated with the COVID-19 Vaccines. 10th, on Thursday, May 22nd at 10 a.m., the Senate Banking, Housing, and Urban Affairs Committee holds the hearing, Securing America, Key Authorities under the Defense Production Act. And last, on Thursday, May 22nd at 10:30 a.m., the Senate Appropriations Subcommittee on Agriculture, Rural Development, Food and Drug Administration, and Related Agencies hosts a hearing entitled, A Review of the President's Fiscal Year 2026 Budget Request for the Food and Drug Administration. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.